Welcome to Cardio Flash College, a place to learn cardiology with flash animations. Today we leave the classroom and enter the cath lab because we are opening a new section on our channel, Cath Lab for Everyone. Join us in this episode.
Today we have a chapter titled General Aspects of Coronary Bifurcation Lesions and Culotte Stenting Technique. To help us in this matter, we will have the collaboration of Dr. Pedro de Sousa and Dr. Pedro Gonçalves, interventional cardiologist of the Hospital Santa Cruz at Lisbon, Portugal.
As you know, coronary artery bifurcation lesions are frequent findings during coronary interventionism and represent, more or less, a 20% of total angioplasties at any center, becoming an entire challenge in the technical and prognostic points of view. Because of these motives, different work teams and societies have dedicated lots of efforts and resources to the study of this entity, obtaining much diverse results. But what is a coronary artery bifurcation lesion? Well, the last consensus document from the European Bifurcation Club uses this term when a significant stenosis exists over a relevant branch of the epicardial coronary tree. In this manner, we can say that a coronary artery bifurcation lesion affects two important branches simultaneously, one of which will be the main branch and the other one will be the side branch. In daily practice, the identification of this pathology is usually made subjectively by the operator, according to his experience and patient's clinical context. However, in the world of interventional cardiology, identifying a coronary bifurcation is not the most complex process. The most complex process is deciding when and how to treat it. In this way, the first question the operator makes is, can I allow myself to lose this side branch? And the answer is not always easy. Some of the factors that could be considered to solve this problem are symptoms, comorbidity, localization of ischemia, diameter and length of the side branch, localization of plaque, and the angle of bifurcation, and so on. Then comes the next question. What strategy must be chosen? A simple strategy with the stent, also known as provisional stent technique, or a complex strategy with two stents? Different studies have demonstrated that the provisional stent technique results easier for the operator, has less risk of peri-procedure complications, and gets a lower rate of cardiovascular events in the follow-up. Sadly, a provisional stent technique is not always possible, and in a few occasions a strategy with two stents needs to be proposed. In this manner, a two-stent strategy can be considered when a severe and long lesion existed on a side branch with good caliber, when a decreased flow, dissection, or other complication existed on the side branch after a provisional stent technique, when a lesion of the side branch produced symptoms or demonstrable ischemia, and when a future access to the side branch was required. Therefore, different angioplasty techniques with two stents exist. Some of these are Culotte, DK crash, TAP, T-stent, and others. With all this said, today we will show what a culotte is and how to use it. A culotte is an angioplasty technique with two stents set in a Y shape and is frequently used for the treatment of complex coronary artery bifurcation lesions, for example, the bifurcation lesions type 111 following Medina. Some of its features are the following. It is an ideal technique for Y-shaped bifurcations. It offers complete carina coverage. It presents two homogeneous layers of metal in the proximal segment. And it is an ideal technique when the main branch and the side branch present similar calibers.
But how is a culotte made? Very simple, step by step. As you will already know, culotte is a laborious technique and many times results difficult to comprehend it. That is why we have dedicated an exclusive video to this technique. This video, titled How to Make Your Own Culotte, will be available soon on our channel. In this way, you will see how to create your own culotte, step by step, and with different perspectives, in order not to lose any detail. Let's see what awaits us. First, we will use fluoroscopy, which offers us a classical perspective that is usually used in cath labs. The second will be our channel's typical perspective, animations. Flash animations will be able to show those technical details that result difficult to understand with real images. The third will be a lab perspective, courtesy of Terumo, Spain. With it, we will be able to observe real stents in a coronary artery bifurcation lesion model elaborated with silicon. And the fourth, but not less relevant, a lab perspective courtesy of the Visible Heart Lab project of the University of Minnesota. In this perspective, it is possible to observe what occurs inside the bifurcation with a video camera, showing revolutionary images and now impossible to get in daily clinical practice. If the Visible Heart Lab project is of your interest, we recommend visiting the University of Minnesota webpage using the link down in the description of this video. In the webpage, you will be able to observe and download information, images, animations, and videos for free related with this and other cardiological models. As you can see, the next chapter of this section is going to be really interesting. However, our time is over. It has been all for today in Cardio Flash College. We hope you liked our video. If so, subscribe to the channel and leave a like. We will see you in the next class. And remember, don't come late. Bye.